our work that we presented during the AD/PD Congress is strictly related to one of the most important non-motor symptoms in Parkinson, which is cognitive impairment. Cognitive impairment is the result of several mechanisms working together and leading to what we call cognitive dysfunction in Parkinson's. So we wanted to look at this from more a genetic perspective. In terms of genetics, we know that Parkinson's disease is linked to several genes, but if we focus specifically to cognitive dysfunction, there is now evidence that there are some mutations which have proven to be detrimental for the cognitive functions of Parkinson's disease patients. And the main evidence has been gathered for GBA mutations, which is one of the most common genetic mutations that increase the risk of developing Parkinson's disease, but also other genes has been studied with mixed findings, such as ApoE, MAPT, COMT, and also SNCA, which is the gene coding for alpha-synuclein. And overall, these genes tell us that when a mutation is present, we can expect a worse cognitive function. On the other side, for the LRRK2 gene, which is it is probably the most common genetic monogenic cause of Parkinson's, which account basically for 4% of all genetic cases and about 1% of even sporadic cases. There is some evidence gathered in the last decades, in the last years, that it might have a protective function for what concerns cognitive function in Parkinson's disease. In general, the clinical phenotype of LRRK2 Parkinson's is very similar to the idiopathic Parkinson, apart from a more, what has been described, a more benign course. And in this more benign course, we can definitely say that the cognitive function is quite well preserved in patients. And our work was suggested by recent findings on a PET study showing that people with the mutation, or even Parkinson's disease patients with the mutation, had increased cholinergic activity in their cortex and in their thalamic regions. And as we know, the cholinergic system, and whose main hub is the basal forebrain, is one of the most important factors in determining cognitive functions, not only in PD, but also in Alzheimer's disease and other neurodegenerative disorders. So our aim was to assess whether patients with the LRRK2 mutation, but even unaffected carriers, had different volumes of the basal forebrain compared with the idiopathic Parkinson's disease patient and healthy controls, and to see what was the relationship with cognitive function. So we used, for our study, we used the data coming as well from the Parkinson Progression Marker Initiative, the PPMI cohort, and we tried to match our genetic cohort of about 32 idiopathic Parkinson, 32 LRRK2 Parkinson's disease patients and 13 unaffected carriers. And we tried to match them with healthy controls and idiopathic Parkinson's disease respectively. To assess basal forebrain, we used a specific stereotactic, a specific mask using the software SPM, which comes from a stereotactic map and post-mortem data, so very precise measurement. And we found that individuals with the mutation, but not yet affected by Parkinson's, had increased basal forebrain volume compared with normal healthy controls. And at the same time, we found that the basal forebrain volumes were increased in LRRK2 Parkinson's disease patients compared to idiopathic Parkinson's disease patients. And our next step was to assess how the cognitive function progressed over time. And we saw that while, and this is very well known, while the basal forebrain volumes were strictly correlated to the cognitive progression in idiopathic Parkinson's disease, in LRRK2 this didn't happen. And in addition to this, LRRK2 patients seemed not to progress over a 4-year follow-up in terms of cognitive function. And in addition to this, we tried to perform a mediation analysis to see if if the basal forebrain was mediating these differences in cognitive trajectories over time. And what we found is, and how we are interpreting our finding, is that probably the increased volume in the basal forebrain in LRRK2 Parkinson's disease or LRRK2 unaffected carrier is the structural correlate of the hypercholinergic activity that has been shown in a PET study before, and this is quite in line in what we said before, that the LRRK2 cognitive profile is much more benign, and this might be one of the underlying reasons. Of course, we couldn't assess the pathophysiological mechanism of this, but we can speculate that the increased basal forebrain volume could be a compensatory mechanism exerted by the LRRK2 mutation somehow, which can protect this population of patients compared to the population of LRRK2 Parkinson's disease. And the future step would be if this could really be a biomarker for this.